CEO of Sickle Cell Foundation Nigeria. And here you are at our National Sickle Cell Center. This center was established by Sickle Cell Foundation Nigeria. It's the first of its kind in all of Africa. And this is something we're proud of. It's a center that serves all of the country. And we do everything that concerns sickle cell, from prevention of sickle cell to treatment, management, care and support, and now even cure. Because they used to say there was no cure for sickle cell. But we have partnered with Lagos University Hospital, LUTH, right across from us. And also we have the technical partner in the Vanderbilt University Medical Center in Tennessee, in the USA. They are technical partners. So they're supporting us in managing, running this bone marrow transplant center. So when you say there's no cure for sickle cell, in Yoruba they say it's "Àìsàn tí ò gbóògùn," but ó ti ń gbọ́ òògùn sí. So that is something that's really big. And we're also again very proud to say that we've been able to step up and bring that so that our people, Nigerians, will have access to affordable and quality stem cell transplantation, and then there will be a cure for sickle cell. So if a patient, when I say cure, if a patient was SS, sickle cell, the patient will now become AA. Wow. If the patient got a donor who is AA. But we can also have a donor who is AA. That is fine. So the patient is no longer SS, but AA. And they will tell you that the difference is like night and day. So it's like being born again. So we're very happy that we've been able to do that. But today is really a day that I want to say thank you. I've spoken too much already. I said it's not a day for speeches, but it's a day to say thank you to the Olajumoke Aziza Olajumoke Foundation. But I tried to say AOG. Simple. Because you know why I'm saying this? I think I mentioned this in our in our Zoom. That is very rare to see organizations, individuals come up to say we want to volunteer and work for sickle cell. Because it's like a cause that nobody's interested in. However, I must say that we're making a little bit of progress, little by little, but it's people like you, which is why we are so happy to receive you in our center today. Thank you very much. We have already said what you give to us. This couch is so important because we talked about leg ulcers. Leg ulcers are one of the worst debilitating complications of sickle cell anemia or sickle cell disorder. It is even, in fact, one of the things that make patients who have sickle cell become suicidal. They think of killing themselves because these ulcers or leg sores do not heal. They just keep returning and returning and returning and recurring. But we have here in our center a leg ulcer treatment unit, and we have been very successful in treating our patients who have sickle cell leg ulcers. And this can only help to improve our services because these patients will be more comfortable. They've even given us liners to cover our pouches, which is what we do in the office. Most places we just wipe. So thank you for that. You're really bringing us up and stepping aside. Now, the equipment we have brought, I can't even count. I quantify. Maybe you will help us. But I know it's millions of naira. Am I allowed to ask? Am I allowed to ask how much? But if we are able, we are going to put it in terms of naira. How much? 7.5 million naira. This is what you could have used to do something else if you wanted. But you have decided to place it where your heart and your lung, are inside. Thank you very much, AOG Foundation. Thank you very much indeed. So we appreciate that. Yes. To make it happen. Thank you very much. Is that okay? Excellent.